Wrong person. Are you not pregnant? Are you not using our facilities free?
If you know that you are not a South African citizen, may you please stand up and leave our hospital. Thank you very much. Thank you, gentlemen. Thank you. If you are not a South African citizen, please leave our hospital.
You are not South African. Please get out of the line. Move out of the line. It's all. Whenever no.
Don't touch me again. If you touch me again, I'll show you now. I'm paying tax in this country for which country? This country for 21 years. South Africa got 100 and something companies in Nigeria. 100. They are using our hospital. You don't talk rubbish.
Dear South Africans, come closer. Come some more. Now explain to us what is happening in your country currently. No, explain to us. We want to know. What is with this new craziness that you guys have started now? Where some South Africans are going to hospitals and, single-handedly bringing out people who are not South Africans and refusing them healthcare. Like, what is happening? What is happening in this modern world of 2025 where we all will know for fact say, people of different nationalities, people of different backgrounds are in different parts of the world, creating family, connecting, working and all those things. You guys are saying that in 2025, you are refusing people of different nationalities who are living in your country healthcare. Like, why you guys go hear this kind of thing for? Like, I know they understand. Some few months ago, it was xenophobic attacks on, other nationalities and all those things. Now, it is refusing healthcare for other nationalities in this 2025 world where we're inside. Like, what happened? Like, I don't understand how some of these groups or some of these individuals sit down and plus say, listen, we'll have to stop other nationalities who live in our country from accessing healthcare. And then you go to hospitals, and then I don't know who are the authorities there. I don't know if their systems are working. I don't know who are in charge of these hospitals. And they allow you guys to come and say, if you know you are not a South African, stand up. And then people stand up, and then you guys work them out and say they don't have to, come to the hospital because they are not nationalities of the South African, country. So they don't have to access it. Like, I don't understand how you guys sit and bring up all these things. Sometimes I wonder if people don't have family and friends who are staying outside of South Africa, probably in different countries. Is that how they are being treated? Or these people that do this kind of things, probably in their whole life, they never travel go anywhere before. Because how can you tell us that in this modern world, people of different nationality who are staying in your country, working, paying tax, contributing to the economy in which you guys are living on, you are telling them that they can't access healthcare. Why? Because they are not South African nationals, they are not from South Africa. Like, is the healthcare there? Is it for free? Even if it's for free, is it for free entirely? People are paying for healthcare. And so if people are saying that some people are refusing, people of different nationality to access healthcare, I don't think it's right. Where I saw, one Zimbabwean woman where the video is trending all over the place. She's heavily pregnant. She came to the hospital for, checkups and all that. And then she was refused access to healthcare. She was matched out and given one. I've seen several videos. There was one video of one Nigerian who, somebody tried to tell him to walk out of the hospital where he tell him point blank, said, listen, I've stayed in this country for 22 years. I have my business. I have my family here. I've contributed to the economy. And so if you come here today and tell me that I can't access healthcare, you must be crazy. The man stood on his feet 10 toes. Gave it to the man, bush, batch. When I saw the video, I was super proud. That's why Nigerians know if you bully them, bro. This man said, I've stayed in this country 22 years. I'm sure when I came here, you were a child. Today, you are standing in my face, standing there, as I have access to healthcare, I should go to my country. Bro, do you know the number of South Africans who are living in different countries? And so imagine people of different nationalities, Zimbabweans, Ghanaians, Nigerians. You are treating their people like this. In your country, and these videos are out on social media. Do you know the risks you are putting, your people in those different countries? Do you know what the risks you are putting them in? Because if every country is saying that, listen, you can't access, healthcare, you are not of, a Ghanaian descent, you are not you're of Nigerian descent or other African countries descent, you can't access healthcare. Do you know the chaos where it will cause? You think it is the will of people to want to be in different countries. If their country, everything is going well, or their jobs are there, or their family are there, you think say they are will to be in different country. And so I don't understand why sometimes these groups of people, today they are, destroying people's businesses, foreigners' businesses in their country. They are looting, they are this. Now you are denying people health care. Bro, this is crazy. I didn't think something like this go to happen in 2025. At least like make it be some foreign land, not in the same Africa that we all will live in. South Africa, and you guys are refusing your own, people, your own black brothers and sisters access to healthcare. I don't think it's right. Because I've seen several videos on social media where people are talking about these things. And sometimes it looks like, say, you ask yourself, what is happening? Why is the government of South Africa not talking about these things? Why these kind of issues are popping up on social media? Because this is very dangerous. It's not a good thing that we have to sit down and papa it. Because these individuals who are doing that, they are recording these videos and posting them out. People can spot them out. But yet again, nothing is really happening. Because it's serious. Like, imagine in Ghana, people walk into the hospital and say, hey, if you're not a Ghanaian, you can't have access to our healthcare, walk out. If you go to Nigeria, Nigerians will say, if you're not a Nigerian, you can't have access to healthcare, walk out. When people are having money to pay for it, when people are not accessing it for free, when pregnant people are coming to access, when people have lived in this country for so many years, you are refusing them, something which is essential to their life. Bro, where do you expect them to go? And so I don't know what is happening. You guys will really explain this thing clearly for us, because it looks like South Africans are beginning to be something else that we don't know about. And obviously, it's not all of them. It is some individuals or some group of people who have sat down to, plan all these things to try and, bring some sort of disagreement, confusion among Africans. Because I don't understand. Even Oyibo man land safe, people go there to survive, build family, start business, establish them. How much more our own African, countries, African world, we are doing this kind of thing. Charlie, I don't think so it's right, because the videos who I see on social media, it is very, very disheartening and very sad to see, pregnant people who are sick being refused, people who are there to have healthcare checked up on things being refused, asked to go walk out. Why? Because some people feel like, they are citizens. They don't want to enjoy the same opportunities with foreigners, and so they want to take matters into their hand. Where are the laws in the country? Where are the ministers? Where are the presidents? Why people are not speaking on this kind of things? We've known, Julius, I think Julius or something, I've forgotten the full name, to be very outspoken about, all these things. So if your own people are doing this to your own Africans, this one is not even foreigners, it's not white to your own Africans, what is happening? These things must stop, because, Charlie, these things is not healthy anymore. People are not smiling anymore. And for this thing like this to come where people will come and say, Charlie, I don't think it's right. And so South Africans, you guys will clearly explain these kind of things for us, because we don't think it is safe. We have families, we have friends who live in South Africa. And if they have to go through this kind of thing, I don't think it's fair as a country. And so I hope and pray they find the best way for it to handle this kind of issue. There are so many important things that might be dealt with. But if it's about health, I don't think it's something that we'll have to be smiling at. Yes, we understand there are some, small-scale businesses that are for, people of the country. People of the nationals, yes. But healthcare, I don't think it is something that you have to fight it and ask people to go to your country and take healthcare. Go this. If everybody they live in country, nobody would like work for anybody for in country. So, Charlie, you guys will really stop this kind of things, and let's focus about African unity. Ghana and South Africa signed an MOU. It be so you both go treat us. If we will shine your eye, if not, we'll go round to our brothers and sisters again, Nigerians, Charlie. Watch some videos from some, events where people have asked, people of different nationalities to walk out from the hospital.
Get out. Don't tell me get out. Don't touch me again. If you touch me again, I'll show you now. You're not going to get help here. Baba, don't touch me. Don't touch me. Don't touch me. Yeah. I'm not going out. No. Please. I'm paying tax in this country. For which country? This country for 21 years. Okay. My business registration is 20. You all are paying taxes. Yeah. So why are you telling me not to be here? Why? Why are you telling me? Yeah. I'm a South African. I got my ID with me. I can't walk out. I can't walk out. Do your work. You can walk out. Yeah. I can't. Hello? Yeah, hello. South Africa got 100 and something companies in Nigeria. 100. They are using our hospital.
I don't know. We're in Lima right now. I'm starting Shadout TV, man. In Lima, right in Lima. We're the Godfathers.
Shadout TV is the best. No worry. They got to the update. My bro, Shadout TV. They are loud. I love it.